That. Check microphone 1 2 1 2. Check microphone. Check microphone 1 2 1. Microphone check. Microphone check. 1 2 1 2 3. What did I do here? I broke something. Check microphone 1 2 1 2. Oops. Maybe this guy. Yeah, I know. Right? Check mic 1. This is worse. Are we live, Jackie? Check mic 1 2. Check. Check microphone 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 20 21 22. Check microphone check. We're good? Sound good? No buzz?
Yeah, no, we're good. As of right now.
We are all good. Check microphone 1 2 3 4 5. 1 2 3 4 5 6 7 8 9 10.
Okay. Good afternoon, everyone, and thanks so much for being here today to help share this important information about vaccinations. And I want to first start by thanking the team at Ted Watkins Memorial Park for hosting us, and that includes the Parks and Rec people who are here. So a million thanks. We've been at this site since almost the beginning of our vaccination campaigns, and we've really benefited enormously from this partnership. I also want to thank Yolanda Vera, who's here. Yolanda, say hi. From Supervisor Mitchell's office, and we're grateful to have her with us. And also, I want to acknowledge how much support she's given public health and health initiatives across the county. We're also going to be joined today by Dr. Jagane, who is the Medical Director of Vaccine Preventable Disease Control and the Acute Communicable Disease Control Program at Public Health, and Dr. Janina Morrison, who's the Chief Physician for the Division of Clinic Services and COVID-19 Vaccine Response at the LA Department of Public Health. We all together look forward to sharing the details of a new updated COVID-19 vaccine that will soon be available in LA County. Throughout the pandemic, we've seen evidence that new tools and resources, including vaccines and therapeutics, save lives. With signs that COVID-19 transmission is rising, we welcome this updated vaccine. We continue to see higher rates of transmission that translate to increased outbreaks, hospitalizations, and deaths from COVID-19 in LA County. Though at this point, I want to reiterate what I said a couple of weeks ago. We have not reached levels that are alarming. One of the best things, however, that we can do right now is to take advantage of the tools we have, including the new updated COVID-19 vaccines, to keep ourselves and our loved ones safe. Public Health recommends that everyone ages 6 months and older receive the new vaccine that is designed to target Omicron XBB.1.5 and Omicron XBB derivatives. More than 95% of COVID-19 strains that are currently circulating in LA County are descendants of Omicron XBB, and the vaccine has been shown in studies to provide good protection against all the strains that are circulating now. With that, I'm now going to hand it over to Dr. Jagane to tell us a little bit more about the vaccine.
Thank you, Dr. Ferrer. I want to start by highlighting some of the lessons we've learned over the past 3 years of administering COVID-19 vaccines. We know that COVID-19 vaccination continues to protect all eligible people over the age of 6 months from serious illness, hospitalizations, and death. We now have even more data showing that vaccines can also lessen the risk of getting post-COVID conditions, including long COVID. We've also learned that administering vaccine to pregnant women can protect infants up to 6 months of age. Currently, these infants have the second highest rate of hospitalizations from COVID after individuals who are over the age of 75. After administering more than 1 billion doses of vaccines nationally and using multiple comprehensive safety monitoring systems, we know that these vaccines continue to be extremely safe in all age groups. And we know that unfortunately protection does wane over time from both infection and vaccination. So all of us need to receive updated vaccines to restore and enhance protection against variants currently responsible for most infections and hospitalizations here in LA County. Earlier this summer, the FDA recommended that the vaccine manufacturers update the vaccine to include the variant XBB.1.5. Since that time, the FDA and the CDC have been reviewing data, including modeling of the pandemic outcomes in various scenarios with new variants and different vaccination coverage rates, performing comprehensive review of vaccine safety, and evaluating vaccine effectiveness for infection, serious disease, and post-COVID conditions, hospitalizations, and deaths in all the different age groups. They've reviewed the data provided by Moderna, Pfizer, and Novavax regarding their updated vaccine formulations. On September 11th, the FDA released their decision on the use of these updated vaccines. The 2023 2024 Pfizer and Moderna mRNA vaccines are approved for use in individuals aged 12 years of age and older, and are authorized under emergency use for individuals 6 months through 11 years of age. The bivalent mRNA vaccines are no longer authorized for use. Novavax vaccines are still authorized for use in persons aged 12 years of age and older, while an updated Novavax vaccine is still under FDA review. After extensive and meticulous review and discussion of the data, the CDC Advisory Committee on Immunization Practices recommends that everyone who is previously up to date with vaccines and is 6 months of age and older should receive 1 dose of the 2023-2024 mRNA vaccine. For those who are under the age of 5, or for those who are immunocompromised, they may need to receive additional doses of the vaccine. They should work with their providers on the optimal number of doses and scheduling. Additionally, we'll have scheduling available on our website. The CDC recommendation is projected to prevent about 400,000 hospitalizations and 40,000 deaths over the next 2 years. Regarding the vaccine itself, the vaccine composition is the same as previous products, with a modified mRNA for the virus spike protein for XBB.1.5, surrounded by a lipid nanoparticle that keeps it stable, some salts and sugars. The only contraindication to receiving the vaccine is as having a serious allergic reaction to a prior vaccine dose or a history of a known diagnosed allergy to the vaccine components. We are so fortunate to have these very safe and very effective vaccines available to help protect ourselves and our loved ones from COVID-19 starting right before the fall and winter respiratory seasons. Now Dr. Morrison is going to share more about where vaccines could be found.
Thank you so much. Public health teams look forward to helping as many people as possible access the vaccines. The updated COVID-19 vaccines will likely be widely available in Los Angeles County by the middle of next week. There will be a gradual rollout to get vaccines on the ground, and it will take some time to get scheduling systems set up. Pharmacies and healthcare providers will be receiving orders directly from the manufacturers and will let their patients and customers know about availability. Regarding where to get the vaccines, we would encourage everyone to reach out to their medical providers and local pharmacy, especially the chain pharmacies. As a reminder, COVID-19 vaccine can be given with other vaccines, so you can make arrangements to get the COVID-19 vaccine and also your flu vaccine. People over 60 should also speak to their providers about the RSV vaccine. There should not be an out-of-pocket cost for the vaccines. Health insurance should cover the full cost of these updated vaccinations. For adults who are uninsured or underinsured, hundreds of providers in Los Angeles County are part of the Bridge Access Program and can provide the COVID-19 vaccine without cost to the individual, including our Department of Public Health vaccine events and clinics. These sites can also be found through links posted at ph.lacounty.gov/vaccines. For children who are uninsured or have Medi-Cal, they can receive the 2023-2024 COVID vaccine for free through the Vaccine for Children program. A list of these providers can also be found at bit.ly/vaccine-for-children sites. Federally qualified health centers, some healthcare providers, and some pharmacies will be part of federal programs to provide vaccines free of charge to uninsured and underinsured children and adults. The Los Angeles County Department of Public Health is finalizing distribution plans at public health clinics and mobile teams pending arrival of the vaccines. We hope that vaccines will be available here at Ted Watkins and Obregon Park within a week, and that our mobile teams will also be able to be out next week offering the new COVID vaccine.
So before we take questions, we're just going to have Janina do this in Spanish. She'll just do a brief summary in Spanish, and then we'll go ahead and answer all the questions.
Esta semana, la FDA aprobó y autorizó las vacunas actualizadas contra el COVID-19 con ARNM de Pfizer y Moderna. El Grupo Asesor sobre Prácticas de Inmunización de los CDC y la directora de los CDC votaron a favor de autorizar el uso de la vacuna actualizada para todas las personas mayores de 6 meses. Queremos ofrecer una mayor protección contra los resultados potencialmente graves de la enfermedad de COVID-19, ahora que vienen los meses de otoño y invierno, cuando esperamos que la transmisión sea mayor. Las vacunas actualizadas se dirigen a una variante Omicron y deberían ofrecer una buena protección contra la enfermedad grave, la hospitalización, el COVID prolongado y la muerte por las cepas COVID-19 que circulan actualmente. Las siguientes recomendaciones se basan en los datos de seguridad y eficacia de la nueva vacuna. Todas las personas de 6 meses o más deben recibir al menos una dosis de la nueva vacuna actualizada. Para los niños de 6 meses a 4 años que nunca hayan sido vacunados contra el COVID-19, se recomienda que completan una serie de 2 vacunas Moderna actualizadas o 3 vacunas Pfizer. Para las personas inmunodeprimidas, se recomienda que hablen con su médico para determinar el mejor calendario de vacunación y el número de dosis de la vacuna actualizado. Las vacunas no deberían tener un coste. El seguro de salud debe cubrir el costo total de la vacuna y para los adultos que no tienen seguro o tienen seguro insuficiente, cientos de proveedores en el condado de Los Ángeles son parte del programa de Bridge Access y pueden ofrecer la vacuna COVID-19 sin costo para el individuo, incluyendo nuestros eventos y clínicas de vacunas del Departamento de Salud Pública. Estos sitios también se pueden encontrar a través de nuestro sitio web ph.lacounty.gov/vaccines, disponibles en español junto con otros recursos, o llamando al teléfono de Salud Pública Centro de Llamadas a 1-833-540-0473. Si alguien está confinado en casa, por favor llame al centro de llamada para organizar la vacunación en su casa. Es probable que las vacunas COVID-19 actualizadas estén ampliamente disponibles en el condado de Los Ángeles a mediados de la próxima semana. Habrá una distribución gradual para conseguir vacunas en la comunidad y tomará algún tiempo para conseguir sistemas de programación establecidos. Las farmacias y los proveedores de atención médica recibirán los pedidos directamente de los fabricantes y usted puede consultar con su proveedor de atención médico o su farmacia local para ver si pueden ofrecerle la vacuna actualizada. Para recordarles, la vacuna COVID-19 puede administrarle junto con otras vacunas, por lo que puede hacer los arreglos necesarios para vacunarse contra el COVID-19 y también contra la gripe. Las personas mayores de 60 años también deberían hablar con sus proveedores sobre la vacuna contra el VRS. La vacunación COVID-19 es un herramienta eficaz y poderoso que ha salvado muchas vidas en el condado de Los Ángeles. Esperamos que todos la aprovechen. Ahora podemos tomar preguntas en inglés y español.
Muchas gracias, Doctora Morrison. Thank you very much. We're open for questions. And I know there's some people on the line, so Brett, yeah.
Give your best argument for those that are maybe experiencing or anticipating vaccine fatigue.
Oh, sure.
Just give me your best.
I have vaccine fatigue, but I'm going to be there getting vaccinated. No, it's absolutely accurate. I mean, also, you know, at this point, the vast majority of people here in LA County, over 75%, fully vaccinated, with a whole host of people having gotten at least one booster. And, 40% of older people got the bivalent booster. So we have people who have gotten vaccinated 5 times already. And I know it can seem like this is crazy. And then I also got infected. So I want to add that we know lots and lots of people who are vaccinated also were infected. That doesn't change our reality. That both that natural immunity you get from being infected and the vaccines themselves, that protection is waning over time. Study after study after study says that it wanes over time. And I think it's super important for people who are at higher risk, older people, people who are immunocompromised, people living with people at higher risk, pregnant women, people caring for infants. We need to get ourselves boosted because we really can't afford to take the risk of getting infected. I know for some younger, healthy adults, they're thinking, well, this doesn't really apply to me. I'd like to say we have not figured out who gets long COVID and who doesn't. And we have not figured out necessarily who for sure isn't going to experience some severe illness. While the vast majority of people who have ended up being hospitalized this past year have been older people, I myself know of somebody who's in the ICU at the moment on a ventilator who's under 50 and was in very good health. And those stories are out there. I'm not the only person who knows somebody who's younger. I think when you have a good vaccine, and as we noted today, it's free, it's going to be easy to access, it'll boost your protection. There's no reason to take the risk of not having that added protection.
Did you anticipate this to be seasonal, just like the flu vaccine?
Yeah, we were talking with the CDC about the messaging on that, and everybody is pretty close to being able to say, the scientists, the researchers, that this does at this point look like it will be seasonal and it will be annual. So I'd like to say seasonal and annual. We've always seen, 2 bumps up. The last couple of years before this year, they were actual surges, big bumps. This year it was a relatively small bump this summer. But our highest risk time has been, in fact, in the late fall and the winter. And that's the highest risk time for other respiratory viruses. CDC is indicating that, they'll finalize their review of all of the studies and really make a final determination on that. But I think we can be very well prepared for an annual flu vaccine and an annual COVID vaccine. So thanks for that question.
What are we at with the positive infection cases and with the wastewater testing?
Sure, great questions around what do we know about community transmission. So cases I would say they've somewhat plateaued this week. They're still relatively high compared to where we were a few months ago. They're not spiking in a way that is particularly worrisome at the moment. We've seen a doubling of cases over the past month or so. But I want to put some notes around sort of the tracking of cases. Just as a reminder, a very small number of cases are actually reported to us, and those are mostly cases where people are having a PCR test, and those are mostly cases that are where people have gone in to get tested because they felt sick. Otherwise, the vast majority of people are testing at home, and we don't see those results. So I think your question about what's going on with wastewater is equally important, because wastewater actually is sort of a passive way of us understanding how much infection is floating around in the community. Wastewater increased a slight amount this past, that we're posting today, but it went from, I want to say, I think 31% to maybe 34%. So we've seen a steady increase. Wastewater data is a little bit delayed, a week and a half to 2 weeks delayed. I think there's still a fair amount of transmission. I think people still need to be careful. I've urged people to put back in place some of your safety measures because there is a fair amount of transmission. But we're not in a place where there's alarming increases in either cases or what we're seeing in wastewater. Rather, we're just seeing a fair amount of circulation of the virus. We've got some new strains that are circulating, and that always means, being prudent is really good advice, especially if you're a higher risk person.
As the disease evolves, is the causation for why people are going to the hospital, is that evolving also, or is it still almost strictly respiratory?
Well, I don't think it's only respiratory related. I think there's a whole host of symptoms associated with COVID. I mean, one of the things we've learned is, and one of the things that makes this virus so dangerous, is it can affect all kinds of body parts. So I don't want to say that everybody in the hospital is there because they have a respiratory illness associated with COVID. Respiratory symptoms tend to be the most common ones that are described, but it's not necessarily the only symptom that leads to somebody getting hospitalized. I mean, tragically, with COVID and with the virus that causes COVID-19, we have all kinds of organs that have been involved, and we've especially seen that when we've been tracking people with long COVID.
Dr. Ferrer, we have several questions from Ron Lynn at the LA Times. I'll go one by one. First one is, what's your expectation for when the flu season will begin? Will it be early or more severe than normal?
Yeah, I was just, thank you, Ron, for the question about flu, because again, there's another respiratory virus. There's a vaccine that's going to be decently effective, as it is every year, on preventing severe illness. We'd like to encourage everyone to go ahead and get that vaccine. Eligibility is pretty much everybody, again, who's older than 6 months. So, again, a good idea to get both vaccines. What we know is that generally, flu season here in LA County has started sort of towards the later part of October, November, sometimes even as late as December, except for last year, when actually our flu cases started going up pretty significantly in the early part of October. I was looking at the data from other parts of the country because, generally the East Coast, the South, tends to see flu a little bit before us, and they are seeing a spike. Nothing huge, but there are some early indications that, again, we might have an early flu season. I urge people, flu vaccines are available at many providers already. We'll have them in public health, certainly at the beginning of October or late September. So I do urge people, go ahead, make your appointments, get your flu vaccine, be prepared for an earlier than usual flu season. And we'll obviously keep tracking here. Right now, we don't see any signs of a lot of circulation of flu, although there are certainly cases already here in LA County as well.
His second question is, many people have gotten COVID recently. Should they wait 3 months before getting the new vaccine, or should they get the new vaccine right after they recover?
Yeah, it's a great question. The CDC has advised on this. What they've said is that folks who have been recently infected, or there are some folks who recently received their bivalent booster, you do have some decent protection that will last. If you just got your booster, it will last for a couple of months, your bivalent booster. If you were infected, it could last, that protection could last as long as 3 months. However, that doesn't mean you need to wait the 3 months. We urge people to talk to their providers and assess their own risk. If you have a job that puts you in contact with lots and lots of people and you're in a higher risk category, you may not want to wait those 3 months before you go ahead and get your new COVID vaccine. There's nothing that says it's dangerous to get that new COVID vaccine earlier than 3 months. It's really just a spacing out issue. We do tell people, you shouldn't get that vaccine until you've fully recovered from any illness associated with COVID.
His final question is, many people might remember having side effects from getting the vaccine for the first time, where they had to lie in bed for a few hours or a day. Is that less likely if they're getting this shot?
I'm going to bring on one of our physicians who's been really tracking on sort of side effects.
Yes, thank you, Dr. Ferrer. So when they looked at the new vaccine products and their trials, they found the same level of reactogenicity, or very similar levels of reactogenicity. The pain, the redness, the swelling, and some people might have the body aches and the fever. So it might be similar. It doesn't seem like those effects last longer than 1 to 2 days. And we do encourage people to try to plan maybe at a time where they can take a little bit of downtime if they need it. I know my husband husband often plans to get his doses on a Friday afternoon, knowing that he has Saturday to recover. The other thing is that you can take Motrin, Tylenol, something to, if you need, if you have those symptoms and you need to get out of bed and do things. So reactogenicity seems very similar. Serious adverse events, very negligible. Thanks.
Dr. Ferrer, we have several questions from Jackie Fortier from KPCC, LAist. When will LA County hit the CDC's medium hospital tier? And will that trigger masking requirements or recommendations in hospitals and care settings?
Yeah, thanks so much, Jackie. I want to note that that medium tier that Jackie's talking about is associated with the CDC hospital levels. Last week, we reported that our hospitalization rate was 7.4 per 100,000 people. This week, it actually dropped a tiny bit. It's 7.2 per 100,000 people. So I don't think it would make a lot of sense for us to go ahead and do a calculation assuming some kind of steady rate of increase when we just saw a small decrease. It could be that our hospitalizations may be starting to plateau. One data point, we really can't make a projection, an accurate projection on that. But it's worth noting we're tracking it. We would welcome signs that hospitalizations are plateauing because it does mean, in fact, that there has been probably a little bit less transmission recently. That would be a good sign. But we'll have to wait until next week to have next week's numbers before we can say definitively whether or not we are still in a path of accelerating numbers of people with severe enough illness that they end up being in the hospital. I do want to let folks know that we have not tied that medium level of hospitalizations by the CDC tracker to any masking requirements here in LA County beyond masking requirements that are already in place. That means there are some businesses and healthcare facilities and providers that still require masking, so please follow those rules. You're required to mask if you're in a situation at a workplace where there's been an outbreak. You're required to mask at a workplace if you're returning after an exposure or you're coming back in after you've been infected between days 6 and 10 of that isolation period. So those rules are there. We have strongly encouraged folks at our skilled nursing facilities to keep those masks on and for folks to keep masks on when they're in public transit. Those are places where spread is easy. We have situations at the nursing homes where we get a handful of cases, and before you know it, we have dozens and dozens of residents infected. So in those situations, they're in outbreak situations, they're all going to be wearing their masks in those facilities. But even in facilities where they're not in an outbreak situation, because it's such a high-risk population, we again would recommend that people keep their well-fitting, high-filtration mask on.
Any final questions from the room?
For military, my question is like, if like in the future, if the positive case will increase, is it possible we can get more like mask requests and all the precaution like previously?
Yeah, thanks so much for the question about, what would trigger a return to sort of that universal masking mandate. As I noted before, if we ever were going to need to return to universal masking requirements, it would be because all of our other excellent tools are failing. I don't see or predict that that's going to be the case based on what we're seeing now, which is our vaccines remain highly effective, our tests are highly effective at detecting, and we have therapeutics that are working. But I've also been honest to say this virus mutates. We all have to use whatever tools are at our disposal that make sense for us to use based on the circumstances. Right now, masking is an individual preference, except where required, as I noted a minute ago. Thank you.
Dr. Ferrer, any final remarks?
No, I just want to thank folks. We really are hopeful that people will be able to easily access the vaccines. I'd like to encourage people who are older, people who are immunocompromised, people living and caring for people who are more vulnerable, pregnant women. Go ahead, talk to your provider, get your questions answered, call us, schedule your homebound vaccine if you're a homebound person that needs to get vaccinated, and make every effort to get in and get those vaccines in the next couple of weeks as availability becomes really widespread over LA County. So thank you so much, everyone. I want to thank Dr. Jagane and Dr. Morrison for joining us today as well. Thank you. Thanks a lot.